Good morning, Lewis.
Hey,
I believe you completed your dental treatment a while back. Is that
yeah,
correct?
that's right.
And how are your new teeth working for you?
Well, they're doing real good. I um, had to retrain myself basically because I chewed on my right side, and after a while, I tried a little bit, and it was just a new experience. It wasn't comfortable, didn't hurt or anything. I just had to remember to chew, so started doing that, and it's been just fine. Had no problem at all.
Excellent. So I believe you were telling me earlier a little bit about what the situation was prior to your dental implant treatment.
Right.
Would you mind sharing that with us?
Okay, I had a tooth removed years ago. I don't know how many years, and then I lost another one. So I wanted to still chew on that side, and the dentist that I had at the time put a bridge, and there was a tooth hanging off, maybe two, and and that would work for a little while. Never did feel real comfortable with it because it would bend, and finally the tooth, the thing broke off, and I went to the dentist, and he said, "Well, you're never going to be satisfied because there's nothing to hold that," and so he suggested that I get an implant, and it didn't know what that was really, but we had to pull a tooth, and then put this implant in, which really is a titanium rod that goes down into the bone, and I was kind of worried about that. They told me that they'd have to drill into the bone and insert this rod, and that made me uncomfortable. But when it was totally explained about that I wouldn't have any decay again, wouldn't have to worry about that, it would fully support chewing, sounded like a real good deal. So that's what we did, and I've been really pleased with that.
Well, you mentioned the process of drilling into the bone and feeling a little bit uncomfortable with that. Was the procedure itself uncomfortable for you when it was being
That
done?
was what was so surprising. I expected to have a lot of pain and maybe the days after, but the fear of the drilling was what got me. What happened is I felt absolutely no pain. I could feel the vibration, but no actual pain. It was just unbelievable that it was not a problem at all, and it was so well. My wife needed something like this. She actually had two, and I wouldn't expose her to anything that would be pain. She didn't like it, but she had it, and she had no problem. So that fear is totally gone. If I had to do it again, I would have another one if I ever have a problem. I'm not getting any root canals anymore. I'm getting an implant and be done with it forever.
Well, that's outstanding. Do they feel stable and secure to you?
Yes, like I said, it took me a while to get used to getting the confidence over there, but it's stable. I chew. I eat a lot of steak. Love it. I'm glad I can do it again. The other thing I had was it would give. This gives. It does not give at all. It's stable. I have no problem chewing, and yes, I'm really happy with that.
Well, Lewis, I've had the opportunity to evaluate for some time since your treatment was completed, the results, and I personally think you have a great result. And just one final question, if I might. What would you tell other people who might be considering undergoing this process?
First of all, I would say you're not going to feel any pain. At least I did, and I don't think, and my wife didn't. So there's, batting 100% on that. Don't be afraid of it. It will work. It will be just like your original teeth, and you don't have to worry about it decaying because it won't. I'm able to clean mine fine, and absolutely no pain. I was a little sore the second day, maybe 2 days, no problem after that. I've never had a pain, and I've been able to chew anything I want.
Outstanding. Well, Lewis, I want to thank you for having had the opportunity to partner with you and Dr. Erickson to be able to achieve your goal.
Okay, thank you.